Welcome, everybody. This is Expecting More Dialogues. Today, we're going to talk about how we can make sure that every mom in America can afford the healthcare that they need. And I'm here with two people who are absolute experts in this subject. Chardonnay Reed is a mom from Texas of an almost 2-year-old. Welcome, Chardonnay. And Jack DiMatteo is a legislative assistant for Congresswoman Lauren Underwood and also a staffer to the Black Maternal Health Caucus. So welcome, Jack.
Thanks, Neil. Great to be with you and Chardonnay this morning.
So normally I would, introduce the conversation a little bit, but today I'm not gonna because Jack's boss offered to do it for us. Congresswoman Lauren Underwood pre-recorded a little bit of an introduction for us. So let's watch that now.
Hi everybody, I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm so excited to be joining you for this important discussion. Expecting More is a project to generate empathy for the needs of birthing people by centering their stories. I want to thank Dr. Shah for hosting these needed conversations and for highlighting why it's so important for us to hear the hardships facing new parents when they lose insurance coverage. That's why I've joined my colleague, Congresswoman Robin Kelly, to advance legislation that would extend postpartum Medicaid coverage from 60 days after the end of a pregnancy to 1 full year, ensuring moms can access the care and support they need and deserve for the full postpartum period. We've already seen this policy, the Helping Moms Act, pass the House of Representatives with unanimous bipartisan support. And I know your advocacy will make a difference in getting this bill signed into law. But we can't stop there. That's why I introduced the Black Maternal Health Momnibus Act, which would build on existing legislation to comprehensively address our nation's maternal mortality crisis and end the racial and ethnic disparities in maternal health outcomes. By investing in community-based organizations, growing and diversifying the perinatal workforce, addressing social determinants of health, and advancing other policies in the Momnibus, we can ensure that every person is able to grow their family with dignity. Thank you for all you do, and take good care of yourselves. Bye, everybody.
So I just want to thank Congresswoman Underwood for your tireless advocacy to make sure that healthcare is affordable for every American, and particularly for your leadership with Congresswoman Alma Adams of the Black Maternal Health Caucus. Let's start maybe by just level setting around Obamacare and the Affordable Care Act. When I was a medical student, the Affordable Care Act did not exist. And every day when I was in the hospital, I saw the injustice of people having to choose between their lives and their livelihoods. And I was very proud as a student to support the effort to stand up the Affordable Care Act. And when I became a doctor, a freshly minted doctor in 2010, the Affordable Care Act passed. And it was always meant to be a foundation, not a complete solution, but a foundation to be built upon. But as we know, that foundation has been under threat in the last couple of years. And we're here to talk a little bit about both how we can continue to build on it and sort of what's at stake in the coming election and in a coming Supreme Court case. But let's start with you, Chardonnay. A few years ago, you found that you were pregnant and you needed to sign up for health insurance in Texas. Tell us a little bit more about that.
I was 19 and I had found out that I was pregnant and I didn't know at all what to do. And so I texted my mom like, hey, so how do I get medical insurance? And she was just like, are you pregnant? And I was just like stunned. She automatically knew off the bat. And I was like, why would you think that? And she said, the last time my daughter texted me, it was because she was pregnant. And I was like, thanks, big sister. That's awesome. You're just like, put the secret out there for me. But yeah, and so my mom told me the best thing that I could do was go out to a representative because she like really hadn't did it in a while and didn't know. And, at the time I didn't have a car, I didn't drive or anything like that. And I didn't know where to go. And so I said, okay, well, maybe I can find someone who can help me. And my mother-in-law had a little bit of knowledge in that area. And so I went to her house and her and I got on the laptop or the computer and we went to we had to find the website because I wasn't even really sure what website it was. But once we found it, we were going through and putting in my information and everything. And it it was just a process. Like as a 19-year-old going through it, it was just so stressful. And I was like, there should be a more simple process to do this, because like, it's sad to say, but there are a lot of teen moms these days, you know? And so it's like, this should be something that a 18-year-old, 19-year-old can go on by themselves and do simply and fast and effectively. But it was just a headache. And that was, I don't know. I don't even know, like just thinking back to it, how frustrated and stressed I was. It's just amazing. It's just like.
So, yeah, I mean, that sounds overwhelming. And actually, we have our medical students every year try to sign up for health insurance in Texas. So we have like a class of medical students and we send them to the Texas health insurance website and we have them sign up and just experience that process. And our first year medical students are overwhelmed too by the process, just so you know. But okay, so you went through all of that and you figured it out because you did get health insurance for a little bit, but then what happened?
Yeah, and so then after I had my son, I just assumed like automatically that I would still have the insurance for as long as he had his, which was like a year. And I actually thought he would have his longer, but that didn't even happen. But so I didn't really worry about it. I didn't think about it too much. And then I got a call telling me, hey, you need to renew your insurance. But when I went on the website, it was saying that I still had to a certain date. And so I was just like, okay, they're crazy. I'm just going to go by the website because I don't know what this is talking about. And like just literally after my son was born, like 3 months or so, just problems after problems after problems, from like mastitis, just over engorgement. Like I didn't understand these things, of course, because he's my first kid. And so I was just in pain and just knew that I needed to go to the doctor. And you'd be amazed at how much these simple like tasks cost. And it was just like, what? For that? And I waited in the room for like an hour. Like I don't know. I don't understand. And just, you know, the mastitis, like I said, engorgement, UTIs, gallstones, just back to back to back. And I had the Healthy Texas Women's, and because it was for women, I assumed it covered any women's problems. And it's just like, it's one of those things where you have to read the fine print. And it was amazing to me, and just astounding how it just didn't cover those problems that I had when they were regarding to issues with my son, like after giving birth to my son, because I never had any of those situations prior to him.
So I'm an OBGYN and I'm hearing this and I'm thinking like, you know, it sounds like you had a hard time after you had your baby, but so do so many people. And mastitis is a kind of common thing. It's really painful and it needs to be treated with, but it's so treatable with simple antibiotics. But it's like one of the most common things that we see people for after having a baby. UTIs, that's the kind of run-of-the-mill thing. These are things that happen to people pretty routinely that they need care for. So it's just sort of extraordinary to me that, you know, I mean, well, it makes sense to me that you had to seek out care. You know, you assumed that you had health insurance that whole time. So when was the first time you were kind of hit with a big medical bill?
The same month, I believe. It was February or early March, and it was like around $15,000. One of the smaller ones were like $1,000 to $2,000, and I was just like, even that is just out of my means right now, you know. And it blew my mind. I stared at it, and I was just like, I don't know. I don't know. I have no idea what to do with this.
I mean, so just to be totally clear, like you had mastitis and you needed antibiotics so that you could continue to breastfeed your baby. And you ended up with tens of thousands of dollars of bills. And you were telling me a little bit about that episode where you had abdominal pain and had to go in and they gave you a CT scan. Is that right?
Yes. So it was about 3 or 4 o'clock in the morning. And the only reason I remember it is because my mother-in-law gets up around that time to prepare her for her day for work. And I just remember like just laying in bed. At first it started out really small and I was just like, okay, it's nothing. You're just overreacting. And then it got stronger and stronger and stronger to where I literally rolled out of my bed, clenching my stomach because I didn't know what was going on. And when we got to the hospital and we were waiting, and this is when I went to Methodist, like not knowing, like I said once before, that I had to specifically go to Parkland anyways for my coverage to be like used, even if if I had that coverage. And so I was sitting in Massachusetts. We were waiting. I got seen ultrasounds. I don't know what the other one's called, but it's pretty invasive a thing that they had to do, and then a CT. And it was when they came back and just told me, oh yeah, you have gallstones and a UTI. And I was just like, yay, okay.
Well, anybody who's ever had gallstones or UTI knows that they're extraordinarily painful. And I think there's two things that story highlights. I mean, you had pain and you were scared and you were a new mom and had a baby to take care of. You went in for care to the emergency room that you could access. And they did what probably any emergency room or doctor like me would do, which is like they just did a bunch of imaging to try to figure out where the pain was coming from. And because it sounds like because the sources of the pain weren't related to the pregnancy in that case, or was deemed that way, and because you went to a hospital that wasn't covered, that laid you out with a whole other set of bills. And these are things that it's not clear to me that most normal people should have to figure out and navigate ahead of time, especially when you're in pain. Jack, maybe I'll turn over to you. I mean, so you, let's talk about you and where you came from, Jack. So a little bit. So you have been staffing the Black Maternal Health Caucus now for a little while. How did you end up doing that, and why?
Yeah, thanks. And first off, Chardonnay, thank you for sharing your story. And I think people hear about these issues like how long does coverage go and what's covered and what bills are we liable for, but we lose sight of the stories behind them, and they are real people. And so I thank you for your strength in sharing your story. I was lucky enough to join the Congresswoman's office in the summer of 2019. She is a first-term member of the House of Representatives. So I came on just about 6 months into her first term in Congress. She was elected in 2018, sworn in January of 2019, and then within 3 months co-founded the Black Maternal Health Caucus with Congresswoman Alma Adams. And again, we know the statistics on this crisis. We know there are at least 700 pregnancy-related deaths every year and 50,000 or more near misses. We know Black birthing people are 3 to 4 times more likely to die than white people. But again, these are not just statistics. Every single one is a story, and the Congresswoman had a personal connection to the story. One of her classmates in graduate school, a dual PhD CDC epidemiologist, and a Black woman died 3 weeks after giving birth to her first daughter, Soleil. And so for the Congresswoman, this wasn't just a crisis that she had heard about or researched. It was one that she'd experienced from a personal loss. And that was one of the motivations to hit the ground running when she got to Congress and co-found the caucus and really have this vision of putting together a comprehensive legislative package to address the crisis. And so I was lucky enough to join the office around the time that package was coming together and get a chance to work on it. And, we're really proud of the bills that we put in there. There are 9 included in the Black Maternal Health Momnibus Act. We think the policies themselves are really important, and happy to get into a few of them and how they even might be directly applicable to some of the issues that Chardonnay was talking about. But I think one of the things that was most important was not just the policies themselves, but the process by which we developed them. And the Congresswoman's top focus throughout that entire process was centering the voices and the lived experiences of the people most affected by this crisis, Black moms and their families, and also lifting up the solutions that have been identified by Black women leading this work in communities across the country. The Congresswoman co-hosted with the caucus a stakeholder summit in July of 2019, and we often quote something that Elizabeth Dawes Gay, who was one of the co-founders of Black Mamas Matter Alliance and a leader in so many of these initiatives, she said very simply, listen to Black women, trust Black women, invest in Black women. The answers to this crisis lie within the Black community. And that was really the guiding vision of how we were putting these policies together. What work is being done in the Black community already that we can lift up and develop national policies to support. And so, for me personally, my whole job was just about listening and learning from the Black women leading this work and, investing in the ideas that they were putting forward, whether it was in New York or in Texas or in Florida. That's kind of how the Momnibus came together. And again, I feel really lucky to be able to staff that work for the Congresswoman.
Thanks, Jack. Yeah, that's quite a story and a journey. And in fact, Congresswoman Underwood's friend, Shalon, I had an opportunity to meet Soleil and also her mom, Wanda Irving, a few years ago through Nina Martin, who is a journalist who contacted Chardonnay, actually, and also wrote very movingly about Shalon's story. And that piece of journalism was a real awakening for me as well, and galvanized so much momentum in our country. And so Chardonnay, I mean, like on one hand, like everything that Jack is saying is like inspiring. Like we have some real leadership around this issue now, which unfortunately we didn't have when you had your baby. But we have some real leadership and some momentum. But, you know, I guess as you reflect on what happened to you, Chardonnay, you know, can you help us understand some of the things about the system that you see as being broken, that are in need of repair?
Definitely, as I was saying a little bit earlier, to make the process, like, make it make sense, you know, have it to where these teen moms, because not a lot of them have support from their family after situations like this happen. So making it where they can go on there and do it themselves, or having a person that's not like, because even I feel like a little bit, like, I'm not saying this is everyone, but just when I tried to call a representative, I also felt like a little bit of like annoyance and or like judgment through the phone. Like, I'm sorry that I need to cover myself so that I can afford the things that I need right now. But just making sure that people are genuinely like making it make sense via phone and or over the internet, as well as just helping the process go smoother, and just making sure that it's clearly stated, like, you know, how long this is going to last and what's all going to be available to that person. Because that's just one of the two of the things that I just really wish I was able to get a full grasp of. Like, those gray areas just need to be clearly elaborated and understood.
That makes sense, Chardonnay. And it almost feels generous of you to say that, like, the main issue is that we have to make things more understandable. And at the same time, like, you had your health insurance pulled out from underneath you. It feels like one of the cruelest features of the American healthcare system is that we do that to people a few months into having a baby. Yeah, I mean, all that makes sense. So Jack, how do we fix it? What do we do about this?
Yeah, there are a few policies that Congresswoman Underwood and her colleagues in Congress have been working on in this Congress that I think are directly relevant to these issues. And the first one, excitingly, is one that we've made real progress on, and that would be extending postpartum Medicaid coverage to a full year after the end of a pregnancy. Because as Chardonnay's story shows, there are so many complications that can emerge beyond the current cutoff of the Medicaid pregnancy pathway, which is 60 days or 2 months after the end of a pregnancy. That's an arbitrary date. We know that the majority of pregnancy-related deaths happen after the day of delivery, and a large portion of those happen more than 6 weeks out. So there's no reason why coverage should be cutting off at this arbitrary date of 2 months. And so there's legislation that has now passed the House of Representatives with unanimous bipartisan support, the Helping Moms Act, which would allow states to extend that coverage to a full year postpartum. And of course, we need to get every state doing that coverage for a full year postpartum. Congresswoman Robin Kelly has been championing that policy. Congresswoman Underwood and others have worked on it too. And I think another key feature there is that it's not just that the coverage itself is extended, but that it's providing the full range of coverage. So, you know, Chardonnay mentioned that some services were covered that she needed, but then others weren't. And this coverage would be, you know, the comprehensive set of Medicaid covered policies. Just having an insurance card isn't helpful if it doesn't cover the services that you need, or if you don't have access to the care. So I think that's probably the first policy that Congresswoman Underwood and our caucus have been working on. You know, another that's slightly outside of the maternal health space, but relevant to Chardonnay's story, is this issue of surprise medical billing. People who, you know, through no fault of their own, end up with a massive medical bill. And, you know, Chardonnay mentioned, you know, it was she was in a different facility than the one that was in the network of her coverage, and as a result has a bill that hardly anyone could even imagine paying. And so there's been bipartisan legislation here in this Congress to ensure that no patient is stuck with one of those bills. And so I think that's another priority to get across the finish line here in this Congress. And then I wanted to just mention a few momnibus policies to, Chardonnay mentioned just this kind of like you're on your own in so many ways as you're trying to navigate this really overly complex system. And the momnibus has a couple bills, the Perinatal Workforce Act and the Kira Johnson Act. Neil, I know that you know Charles Johnson so well, who's been an incredible advocate and champion on this issue after losing his wife, Kira. But both of those bills provide funding for whether it's doulas or community health workers or navigators, peer supporters, a bunch of different names in different places, but basically people who can help navigate signing up for insurance, getting access to the services you need, and also doing it in a culturally congruent way. Chardonnay mentioned that when she was on the phone, the person sounded like annoyed or not really like truly caring about your situation. And so how do we make sure that the people who are helping you with that process can relate to your experiences and can actually listen to you and respect you and hear you? And so those are policies that are in the momnibus. The final one that I'll mention in the momnibus is the Impact to Save Moms Act, which really focuses on the issue of continuity of coverage, including automatic re-enrollment for people who are eligible. So, as Chardonnay mentioned, the coverage cuts off, and then you don't really know when or how you're supposed to be re-enrolling in some new form of coverage. And so, the Impact to Save Moms Act tries to see, well, how can we just make sure that if someone became eligible for Medicaid or, whatever the specific program is in their state because they're pregnant and they remain eligible for Medicaid as an adult, how do we make sure that they are automatically re-enrolled instead of having to navigate another elaborate process? And so what policies do we need to put in place to ensure continuity of coverage throughout pregnancy, labor and delivery, the full year postpartum and beyond? So those are just a few of the policies that I think are directly relevant, and also ones where we've seen real progress and hopefully could get across the finish line in this Congress.
That's right. Yeah, no, let's get that done. Yeah. I remember, I'm old enough to remember how thrilling it was to have one piece of federal legislation related to moms, and the fact that we now have a whole package of this whole suite of solutions, to almost every part of Chardonnay's story. There seems to be something that we can do. Chardonnay, I want to turn back to you and just you described what happened to you after having your baby, and we got to meet him a little bit when we prepped last time. So it's been almost 2 years now, and just where are you now with with these bills?
So yeah, I haven't even started on any of them, and for a while they stopped calling me. But then they started calling me again, and I was just like, I'm still not in a further situation than I was before. I'm working on it. I have gotten myself in better economical situation, but it's still not nearly enough at this moment to even start on one of those bills. And so it's just I promise, when I am able, I will, because that's who I am. I get things done when I'm able to, but just constantly receiving one in the mail or having them call me and remind me about it, I'm just guys, I know, please stop. And it was the fact that it was you said, my son's almost 2 years ago, and I'm still just staring at these numbers. It's just crazy.
That's terrible. I'm so sorry that you're still dealing with that. As Jack said, thank you so much for sharing your story and for your bravery and persistence, and then for advocating to make sure this doesn't happen to other people. And I guess that's probably where we want to close. For people who are watching this, I think for a lot of people who are watching this, maybe they're stuck with bills too. This is the least affordable healthcare has been for the average American in half a century. And then there are other people, hopefully, who maybe aren't saddled with big bills, but are at risk of maybe being saddled with big bills, or just think that this is wrong. So we mentioned at the top that there's an election coming up. There is a Supreme Court case coming up that threatens to dismantle a lot of the foundation of what Jack was talking about. Chardonnay, what would you tell people who are listening? What do you want them to know?
I would say that guys, this is a serious situation that a lot of people don't think about. Being 19 and hearing about postpartum and like postpartum depression, I didn't think anything of it. I assumed I wouldn't be that person, like, oh, I wouldn't get PPD or what is postpartum anyways. Like, it's just, first off, get educated on postpartum. That's one. If you're not a mom or a woman, if you're a husband, a boyfriend, whatever, learn about those things so you can understand what your significant other is going through. And just vote, guys. Like, make a difference. Be the catalyst, be the butterfly in the effect that helps to make this happen. So that's what I would say.
Thanks, Chardonnay. And Jack, anything that you want to add and tell the audience?
I don't think I could put it any better than that. Truly, again, thank you so much. And Neil, like you said, all the progress that, you said you started in 2010 as the ACA was going into effect. 20 million people have gotten health insurance because of the ACA. People with pre-existing conditions are protected because of the ACA. And the lawsuit in the Supreme Court right now threatens to rip that all away in the middle of a once-in-a-century health crisis. We have to protect the Affordable Care Act. And as Chardonnay said so eloquently, we've got to vote too.
Thank you both so much for being a part of the conversation today. And get out and vote, everybody.